ABC Chief Medical Correspondent Dr. Jen Ashton with us as well, and we certainly have a lot to get to.
And we're talking COVID, so yes, you said the season's changed. We're going into fall. We thought this would be a fall, that everything would be opened up, but in respect to COVID, what are we looking like going into the fall?
Well, I think this is a good time to take stock of where we've been and then where we may be going. So let's look back, if you will, and look at least the summer of COVID and what it's done for us and where we are in this pandemic. First of all, in terms of testing, good news. Obviously, we have better access and better turnaround time, so that's improving. In terms of prevention, we're hearing more about these so-called NPIs, these non-pharmaceutical interventions, things like mask wearing, distancing, ventilation. They were important in the beginning. They're still important now. Vaccines, yes, we have several that are authorized. We have at least one that's approved. We have others in clinical trials for babies starting at age 6 months of age, so that is ongoing. And then treatments, lots of improvements in this area. Outpatient antibody cocktail being used more and more, and inpatient clinical care of those patients hospitalized definitely improved.
Yeah, I mean, we accomplished a lot this summer, and now we're all looking and wondering and, you know, concerned. What is the fall? What is the winter going to look like?
Well, you've heard me say it before, and while everyone likes to make forecasts and look at these prediction models, no one has a crystal ball. There are more questions and variables here at this point, but things that we don't know the impact of for this fall and winter season. How indoor gatherings will affect the pandemic rates. Will influenza or flu be a player this year? It wasn't last year, thank goodness, but we don't know about this season. We have to see how the in-person school attendance pans out in terms of transmission, both for students and faculty and adults. And then we have to keep a close eye, as always, on our hospitals, on our healthcare system, that many of which are at or over capacity. And we will be looking at that as we look at all these elements throughout the winter and fall.
All right, Dr. Ashton, thank you as
Lot
always.
to look at.
Of course. We know you got an eye on a lot of stuff for us. Appreciate you as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.